Okay, this is Jacob Nelson for Exam 3, Essay 2. First question is, explain the pressure volume curve for a single cardiac cycle. Okay, so we'll be going over this diagram right here. What we have is a shape that follows the pressure volume, gradients of what a single cardiac cycle, when it pushes blood through and out, will look like. And it also includes a inotropic line, which basically just talks about the how stiff, or the stiffness of ventricular contraction before it starts to relax. So on the bottom here you have volume over pressure. So this bottom corner is the point in which the ventricle, right before it starts to fill up, starts. It does start with a little bit of blood already in it, and as this starts to increase in blood from the atrium, it stops to here, which we call the preload. This is the maximum amount of blood which is in the ventricles right before the pressure increase to eject blood into the aorta. And that point right before ejection, at the highest peak of pressure at relaxation, is what we call the afterload. The afterload is the energy the ventricle needs against the pressure of the aorta in order to eject blood through it, through the semilunar valve, and which, at the point of the afterload is also when the SL, or semilunar valve, opens. This point, this is also considered the afterload, this arch across. That is the point of, where all the volume of blood is leaving. And we get to this point right here. At that point, we have a where the max point of ventricular contraction right before it starts to relax. We have that point measured with a line. That's the inotropic line. And so one cycle of all of this, what I just explained going around, is one single cardiac cycle with its reference to pressure and volume. Within the this, shape, you have the what does that stand for? I think it stands for systolic volume. That is the amount of blood that is in the ventricle between those ejections and relaxation. So next question, let's see, we want to describe how baroreceptor reflex is, or what it is and how it works. So in the aorta, past the heart, and a little bit up the cephalic trunk and the more of the arteries, for example, there are these baroreceptors. They are basically stretch receptors, and when the aorta fills with blood, the aorta stretches along with the baroreceptors, as well as all the baroreceptors in that region. When it starts to fill up, it stretches. That sends a signal which increases the stimulation of the baroreceptors. And the baroreceptors connect to neurons within the body that is both either sympathetic nervous system or parasympathetic nervous system. If the baroreceptors are being stimulated due to stretch, this will activate the parasympathetic system to increase or cause its effects, which would be to lower heart rate, which will in turn decrease blood pressure, etc. And the baroreceptors will also inhibit the sympathetic nervous system, which helps balance what the parasympathetic nervous system is trying to do. When the baroreceptors or the aorta isn't stretched, it's in a relaxed state. That is how would that affect the stimulation? Well, this decreases stimulation on the baroreceptors, which will decrease the parasympathetic nervous system and increase the sympathetic nervous system. What this looks like is increase in heart rate, increase in blood pressure, things in that nature per se. Okay, so that's essentially baroreceptor reflexes and how that works. Now we want to talk about the mechanism of which fluids normally move out of and into capillaries. So I'll be using this diagram here. So we have arterioles into the capillaries and into the venules. Arterioles have smooth muscles that are able to contract and control its pressure. And within the capillary, we have a couple of different things. So here is an example of red blood cell passing through the capillary. On this end of the capillary, on the arterial side, we have a hydrostatic pressure, and that typically at a normal range is 30 millimeters of mercury. On the other end, where the venules are, we have a 10 millimeter of mercury of pressure. That's because, usually in the venous system, we don't have as much pressure as you do in the arterial system. Within the capillaries, we have molecules from the liver. It's called albumin. This is impermeable molecule. So it's not able to pass into these cells that are right next to the capillary bed. These cells near the capillaries actually is permeable to almost anything really, except for, like I mentioned, albumin and possibly extras, but things that ions before that weren't possible are now permeable. And so because of albumin being in the capillary bed, that brings some fluid because of osmosis into the capillaries. And we label this, this concept of pressure BCOP, which is typically 28 millimeters of mercury. And you also have other types of solutes outside of the capillaries, which brings fluid out of the capillaries into the interstitial fluid space. This is known as ICOP, and it's typically lower at 8 millimeters of mercury. And so what does all this really mean? I mean, what we want to know is, in a clinical way, how does extra fluid in the capillaries or extra fluid in the interstitial fluid really impact us? And there's a phenomenon you can see, I guess not a phenomenon, but a symptom or a sign that you can find in people. It's called edema. Pitting edema, especially, is just where a collection of fluid, typically around the lower legs, is seen. And if you were to press or push into it, it leaves your indent, it leaves the mark in there because of the fluid, not able to being pumped through the circulatory system. And the way we can tell whether this can happen or not is to find the net pressure of everything, of how much fluid is coming in, how much is going out. And in a normal system, you would find that the fluid leaving the capillaries is typically greater than into the capillaries. Knowing that pressure, I guess, helps us to understand what's really going on. And so, but this could change, right? And the reason this changes could be, varying in many ways. Typically, what's supposed to happen is you got the lymphatic vessel here on the, where the interstitial fluid is. And due to its nature, it has this vacuum effect, pulling fluids and everything into the system. That also has a -3 pressure of millimeters of mercury. And let's say the lymphatic vessel doesn't work. Well, now it's not typically pulling fluid through it anymore, and it's leaving it in the interstitial space. Let's say you have, down the venule side, it's going through veins into the, the vena cava is right before the blood enters the heart. Let's say that's somehow blocked, or you have a heart failure where that atrium of the heart is blocked somehow. Well, now you have a backup of blood in the venous system all the way to the venules, even to right before the capillaries. That's going to cause an increase in pressure of the hydrostatic pressure of 10 over here. It'll increase it, which will create more fluid leaving the capillary bed into that interstitial fluid, which you could typically find a sign as edema. Or let's say you have a liver problem and it's not able to create albumin, causing B-cop to function normally, and then you can see where this is going. All right. Describe various forces involved. Yeah, we did that. So in order to maintain these different functions of fluids running through the capillaries, it's important to figure out the net pressure of everything, whether it's going out or in. And I guess if people are showing signs of edema, you can help them to increase the fluid going into the capillaries to run through the circulatory system. Let's say, someone has edema, you give them a compression sock to wear. So it's, forcing compression fluid into the capillaries, run around the system. Or let's say you have elephantitis, which is a parasite that eats through the lymphatic system, which basically causes it to no longer function. Perhaps there is some sort of surgery in order to fix this. And so you do that so that they're able to have regular lymphatic circulatory system. It's important to remember that things that are trying to help prevent these cases from happening in the veins and in the lymphatic system, you have valves where when blood rushes through and it tries to come back, well, it stops where these valves are, keeping it from backflowing down into where it just came from. Whereas arteries do not have this, the valves to function, or they just don't have valves. But what they do have, like I said earlier, is smooth muscles, which will contract or relax depending on, what is going on physiologically in the body. This can help relieve pressure, increase pressure, etc. All right. I forgot to mention earlier variables for MAP when it comes to pressure in the system. Let's see. So MAP stands for mean arterial pressure, right? And how this is calculated is we have cardiac output times the peripheral resistance. So cardiac output has to do with this chart we looked at earlier, how the ventricle will increase in the volume of blood until it creates enough pressure to eject it into the aorta to the rest of the system. And so the rate in which this stroke volume happens, that's the word I was looking for earlier, stroke volume, that's one cardiac cycle, right, the stroke volume, and we multiply that by the rate of your heart rate, or how many beats per minute the heart is beating, and that gives us cardiac output. So we take the cardiac output, multiply it by the peripheral resistance. This is how much resistance the elastance of the arteries have. There's an equation for this. It is 8 times volume times length, viscosity over length times length over pi r to the 4th power. And so this helps us to find what the mean arterial pressure of our body is. Let's see. This typically is the pressure. The MAP is great during its larger arteries, and it starts to taper off through the arteries, arterioles, down into capillaries, and even venules. It gets really low down there because you only need the pressure to be greatest, you know, pumping through there. And then the venous system has different mechanisms of pumping the blood through the body. For example, skeletal muscles. But yeah, had to go back and explain that. Anyways, that should be everything for this video. Thank you for listening.